Here are 5 things you need to know about recurrent urinary tract infections. If you've ever had a bladder infection, you know they're miserable. But here's the scary part. Up to 40% of women who had one will get another, and many will have them over and over. That's what we call a recurrent urinary tract infection. 2 infections in 6 months, or 3 in a year. Today we're going to break down the top 5 things you need to know about recurrent UTIs, straight from the American Urological Association guidelines. Number 1, hydration is a proven prevention tool. If you're drinking less than about 1.5 liters of water a day, that might be increasing your risk. In one study of women with recurrent UTIs who drank less than that, adding about 1.5 liters of water a day cut the average number of infections almost in half, from 3.2 per year to 1.7, and dropping the percentage of women with 3 or more UTIs in a year from 88% down to under 10%. They also went longer between infections, 143 days on average versus just 84. So if you're not drinking enough water, let's start there. Number 2, vaginal estrogen. This is one of the most effective tools for postmenopausal women. For peri and postmenopausal women, the AUA guidelines are clear. Clinicians should recommend vaginal estrogen therapy to reduce the risk of recurrent UTIs, even if you're already on systemic estrogen pills, patches, or pellets. That's because these systemic estrogens have not been shown to prevent UTIs and come with different risks and benefits, while vaginal estrogen works locally with minimal absorption. Multiple randomized trials show that vaginal estrogen, whether as a cream, tablet, or ring, can significantly cut infections and extend the time between them. For example, one study found women using estrol vaginal cream went from nearly 6 infections a year down to just half of an infection per year, and cut antibiotic use by 80%. There's no clear winner between creams, tablets, and rings, so the best choice is the one that you'll actually use. Typical regimens start with daily application for 2 weeks, then maintenance 2 to 3 times a week. And here's more good news. Vaginal estrogen has not been shown to increase cancer recurrence risk, even in women with a personal history of breast cancer, though decisions should be made with your oncologist's input. The bottom line, for the right patient, vaginal estrogen is safe, effective, and one of the most powerful non-antibiotic prevention strategies we have. Number 3, know the real symptoms and the right way to diagnose. The most specific symptom of a UTI is sudden burning when you pee, especially if it comes with urgency or needing to go more often. For a true diagnosis, the guidelines say you need both symptoms and a positive urine culture. And here's something important. A low number of bacteria can still be significant if you have symptoms. On the flip side, having bacteria in your urine without symptoms, called asymptomatic bacteriuria, should not be treated in most cases because antibiotics won't help and can actually increase your risk of resistant infections later. Number 4, myths and misconceptions. Peeing right after sex, wiping front to back, avoiding hot tubs. None of these have strong evidence for preventing UTIs. What is backed by research? Avoiding spermicides and in some cases, changing birth control methods. And here's another myth buster. You don't need cystoscopy or a kidney scan for most recurrent UTIs unless there's something unusual in your history or exam. Check with your urologist. Number 5, cranberry. What does the evidence really say? Cranberries have been studied for decades as a way to prevent UTIs, and they've gotten renewed attention because of rising antibiotic resistance. The key compound is called PACs, which can make it harder for bacteria to stick to the bladder wall. Multiple randomized trials show cranberry can reduce recurrence compared to placebo. One saw a 20% drop in infections with cranberry juice, and another cranberry fruit powder significantly reduced UTIs over 6 months. But here's the catch. PAC levels vary a lot between products, and many research-grade versions aren't sold commercially. Compared head-to-head with antibiotics, cranberry was generally less effective at preventing infections, but had a huge advantage: much lower rates of antibiotic-resistant bacteria in breakthrough infections. Bottom line, cranberry isn't a cure-all, won't treat an active infection, and sugar content in juice can be an issue for diabetics. But it's a safe, low-risk option worth discussing with your doctor, especially if you're looking for an antibiotic-free prevention. Bonus: antibiotic use and stewardship. If you do need antibiotics, the AUA recommends short courses, generally no longer than 7 days, and starting with first-line options like nitrofurantoin, Bactrim, or fosfomycin. Based on local resistant patterns, check with your doctor. In select women, a self-starting prescription can be a game changer, allowing you to begin treatment right away while waiting for culture results. But unnecessary antibiotics can fuel resistance, disrupt your gut microbiome, and cause side effects. So targeted culture-based treatment is always best. So here's your game plan. Drink more water. Consider vaginal estrogen if you're a candidate. Know your symptoms. Skip the myths. And ask about cranberry or other non-antibiotic options. And above all, get a urine culture before starting antibiotics. That's how we break the cycle of recurrent UTIs and protect ourselves from the growing threat of antibiotic resistance.